Future nurses, it is Dr. O with Nurse Pronto. So let's get ready to flex those wound care skills. And let's dive into 3 NCLEX style questions focused on wound assessment and dressing techniques. So I will reveal the right answer and explain why so you can feel confident on the exam and in the real world. Let's look at the first one. Which wound type is considered a full thickness injury? Is it an abrasion, a stage 1 pressure injury, a stage 3 pressure injury, or a superficial burn? If you answered C, stage 3 pressure injury, you're 100% correct. Okay? Because a stage 3 injury extends through the full thickness of the skin, even possibly exposing subcutaneous fat, but not bone or not muscle. That would be stage 4. So, but abrasion and superficial burns, that's only the epidermis or the epidermis. And stage 1 pressure injuries are intact skin with non-blanchable redness. So definitely not full thickness. So think depth when you're assessing wounds. Stage 3, deep enough to involve full skin loss. And nobody wants that. All right, question 2. Which technique promotes wound healing during dressing changes? I want you to look at all of this. Would you use a dry gauze on the wound bed? Would you apply hydrogen peroxide daily? Would you maintain the moist wound environment? Would you keep the wound uncovered for air drying? If you said C, you would maintain a moist wound environment. You are absolutely correct. Moist environments promote cell migration. It enhances tissue regeneration, and it reduces pain and infection risk. So a dry gauze just sticks on there and can tear healing tissue. And hydrogen peroxide, no, it kills healthy cells. So leaving the wounds uncovered leads to really slower healing, all right? So remember, moist, not wet, and the healing happens to be in the Goldilocks zone, just right, all right? Just right. Hopefully you have got these 2 right. We're moving on to number 3. Let's see if you can do it. What should the nurse assess first in a newly dressed surgical wound? Is it the amount of drainage, serous drainage, the type of dressing used, the approximation of the wound edges, or time since the last dressing change? If you said C, approximation of wound edges, then you're absolutely right. I bet you didn't think I was going to throw another C in there, but I absolutely did. So your first thing you're going to assess is whether the wound edges are approximated, meaning the edges of the skin are coming together. That tells you if the wound is healing properly or if there could be some dehiscence going on there. So drainage type, dressing type, all those things are important, but tissue integrity is priority. So, and I want to tell you, any kind of open or gaping surgical wounds, that can be early signs of infection and breakdown, and you need to assess approximation first. All right, so how'd you do? Drop your score in the comments. You can tag a classmate to test their wound care skills, and don't forget to follow us at Nurse Pronto Daily. We have exam tips, cheat sheets, and more NCLEX ready content, all for free. And head over to nursepronto.com for all of those free study tools.